Hello, good afternoon. It's me, Sulayman, so I just come in on a quick Facebook Live. I've not done one for a while due to just been busy. But I have to use my phone to come and have this conversation, record this conversation and share it. And more so to take it off my chest. I woke up this morning. Modu, if you can hear me, please just send me any comment or sign to let me know you can hear me well. I just want to do a quick recording here. Woke up this morning and from yesterday actually, something keeps sticking on my mind, thinking about it. Felt sad, worried, and everything. And that's the state of our healthcare system. Thank you. I had a friend of mine who evacuated his dad from the Gambia to Senegal. And that's one of the conversations I had, and brought more insight into the state of our healthcare system. But not only that, a few days ago, in one of the WhatsApp forums by the Gambian London Mosque Forum, they normally put the obituary announcement in the forum. And I just noticed that two of the obituaries put there, both announcements. The people they announced passed away in Senegal, in hospital in Senegal. But apart from those two obituaries in the forum, I know of other three that passed away in a week in Senegal. And the people I know, not the two in the forum, the other people I know outside the forum, families talked about misdiagnosis in the Gambia. They were misdiagnosed. And that misdiagnosis again resulted to late diagnosis. What I am trying to explain is because they've not been diagnosed properly. The time they've been diagnosed properly, it was too late for them. When they went to Senegal, technically, it's kind of a palliative care. It was not treating them anymore. And if that is the number, that number represents a lot in my thinking. And that's why I want to share this. For Gambians, we think about this. To show the true state of our healthcare system. I know for the people visiting our clinics, our hospitals, or people who cannot even visit the clinics or the hospitals due to the fees they have to pay to access them. But again, for the people in the diaspora who support people that visits or access the hospitals or clinics, or whatever, or the relationship they have with the people visiting hospitals and clinics, we know the reality on the ground. We know the reality on the ground. But how much do we know? Apart from the personal experiences that people who access it have, personal experiences that family who access it have. That's why I want us to have a conversation to realize what a grave danger we are living in. What a grave danger we are living in right now, and it's not been managed well. And there's no hope that this government is going to do better with it, because they are politicizing it rather than finding the strategy to fix this problem. And I'll come to that. I'll come to that later. The evidence, it's not only, I know we can find the evidence that things are not working in many, many, many areas. Not even the latest, where the President mom, bill for the security or the support staff to escort his mom to Senegal cost, let's just go for the numbers they provided. About 1.6 million for just escorting. And for them to say that Senegal pays the bill and everything else, I cannot believe it, because I will not believe everything this government says in absence of them producing the evidence, especially if it does not make sense. And this is just one transaction for a medical checkup. A president without empathy would do that. Use taxpayers' money with all that you are catered for your first family, immediate family, with all this, the huge salary you are paid, one of the biggest compared to our economy. Compared to our economy to every country in the world, we have the highest paid president compared to our economy. Compared to our economy. To pay that much for just one visit, for the security, and I can tell you for other costs, 2 vehicles, petrol, the hospital bills, the living conditions and other things, just imagine how much that would have done for us. If you have neglected not to rescue, in 8 years, not to rescue our healthcare service, you should then be human enough to have empathy to use the money that you are paid legally to take care of that, not us. And I can tell you, the president moms, not only he goes for medical checkup in Senegal, but she is treated in Turkey. Then tell me how many times, I know of multiple times she's gone to Turkey. How much was spent on the trip to Turkey? How much was spent from our coffers? Because we only know of this one because a whistleblower leaked the request letter. How much have been spent? You see, it comes to the affordability. And I can tell you, the president's brother go for treatment to India. The president's sister go for treatment in Spain. Let's say the entire extended family of the president now are not using our healthcare system for nothing. This is to register the nature. This is another evidence to register the nature, and not only the president. Many civil servants, as those who have access to $40 million, the last time I've checked, probably is increased for medical emergencies. They cater that because they know that our healthcare system is not fit for purpose. But if we look at the numbers, we imagine how many Gambians are right now today, in Senegal, for conditions that could have been taken care of in the Gambia, if we had the proper, the right, people in power. How many Gambians are in Senegal right now? And those are the ones, some of them who can afford it, others who doesn't have any other choice. They have to prioritize their health. It's not that they can afford it. What about those who can't afford the healthcare to pay for Senegal? The where would be the cheapest? Not Turkey, not India. What about those Gambians? Those are left to die, left to suffer and deteriorate, and what the impact that have on families. We have to remember that. When a mother is sick, what impact does that have in that family? When a mother dies, what impact does that have in the family? When a father is sick, what impact does he have in the family? When a child is sick, what impact does that have in the family? We have to start to critically look at this, and we understand the magnitude of suffering, magnitude of the things because of the economic, cost and everything else surrounding, and the suffering, pain and suffering. These are things we need to really diagnose, not just to run politically and criticize. Let's take our time and get into the details. And probably then people will realize how much and what we need to do to salvage this. And the other critical point to look at, it's when we talk about the healthcare delivery system, it's in a total mess. Not the state, not the public, not the private. Private clinics in Gambia are total shambles. Most of it misdiagnosis, in fact, happen in the private clinics. And people get delayed. Their cancer, they will not detect the cancer. They will not detect the whatever other conditions are. It gets delayed, and the delayance of diagnosis causes life. Delay of diagnosis causes life. The earlier it gets caught, it can be salvaged. But we cannot solely blame the private sector for failing. We have to blame the policy makers, the authority, overseeing authorities for their failure in making sure we have a delivery system. This is where I want to say, we do report the attitudes of healthcare workers. We do attitude, of many issues about healthcare workers. But I am not here to blame them. I am not saying that they don't have responsibility to this. But if you think about it well, some of their failings, or most of their failings, is due to the failure of the entire system. It takes a lot, to have a good healthcare worker. It takes good training. It gets good to be motivated. It gets equipment and many other things to make a person a good healthcare delivery worker. Then again, we'll come to the governance. We come to the policies. We come to the overseeing authorities. That's why we have the private field and the public fields. And we run to Senegal. And the sad part of it, most of people that will go to Senegal, it's already too late for them. But with life, you throw everything that you have into it. And what you don't even have in order to save your loved ones. And they will end up dying because of they're already dead before they even get to Senegal. Because of the negligence, because of the poor delivery system, the lack of prioritization, the corruption. We had the huge corruption at the Edward Francis Small Hospital. They said they went for investigation, nothing is done, and nothing will be done about it. We had about the one in Birkama, we had the one about Sarakoda, that it goes, as it is in every institution in that country. Because fish would start to rot from the head, and the head is completely spoiled. Completely spoiled. Now, we look at these numbers again, that if so much people are dying and coming back, what does that tell you? Obviously, you pay for that much to go to Senegal, because most of them are already too late to be saved because of the poor system. You see, if we study the best delivery systems, it's not only about the resources of money, finance. Where can I reference? Cuba under embargo. Cuba under embargo. If you go to Cuba, you won't see flashy hospitals, you won't see all this. But they have a strategy, they have a program, and they followed it from the beginning. The minute they assumed office, they were sanctioned, not sanctioned, embargoed. Sanction is selected areas be shut down. The entire country was shut down. The little they have was coming from their allies from Russia or China. And the beginning is not when China was wealthy. It was when China was poor. Mainly it was Russia trying to prop them up by buying their sugarcane, above market price and supporting them in budget support. But their strategy by training, maintaining, whatever they did, the systems they have to put in the neighborhoods, for diagnosis, early, whatever it is. Today and for many years, they have been stopped. Not today and many years since they came into Republic, as the administration. However poor they are, with all the conditions, they produce more physicians than any country per population. You go to the Caribbean, you go to the South America, you come to Africa, come to Europe here. One of their biggest export is intellectual property on medicine. Intellectual property on medicine. Many vaccines been licensed in Spain are not invented by Spanish. Spanish. They are invented by Cuban physicians. Because of the embargoes, they have to put it through license in Spain. What about a country that's not embargoed? Why can't we achieve it? It's not only about poverty of finance, it's about the leadership that can bring the thinking and the right strategies to deliver, not to be politicized. If we consider the numbers, we all will know, because our families. We don't have, and I will say this, when people want to differentiate the people from the diaspora and people on the ground, yes, in some instances there's a difference, but I can tell you mostly the pain and suffering we share. You see, pain is not only what is inflicted onto this, the physical body, but pain is what is inflicted in the souls and minds of people. I can be off distance and be more hurt than someone closer to this thing because of my empathy, because of my concerns. Empathy and concerns are very important for us to be human because of our humanity. That's why I said, if we assessed, we will know. Because our physical bodies are here in the diaspora, but our soul and minds are with our government people. I can tell you, when there's death, and this is not, let me digress a bit. I'll tell you this, it's something I looked at. If we understand our society, there's a hierarchy of importance. The hierarchy of importance is not based on the logical understanding of humanity alone. It's based on affordability or someone who can contribute more. It's not based on humanity. It's not based on the person vouchers. When there's death within the community, who would they first think about? What do they first think about? You see, that hierarchy within society, within the Gambia, that's the hierarchy again they apply to the diaspora. I can tell you, if something happened in a family, if they are to contact the people, their family members in the diaspora, the people they would likely contact first are people they expect to participate in dealing with the issue. And if I say in dealing with the issue, it's not only monetary terms. The person who they feel is more empathetic. The person they feel would be more strategic in everything. That's what human beings would act. That's why I said that we might be away, but we are so much involved that we all know these facts. Any Gambian you ask will tell you. How many people do we know that go to Senegal? The bulk will go to Senegal because of the affordability. Bulk will go to Senegal, affordability. But imagine, then those who can't afford Senegal, the other bulk will go to the private sector, even though in most cases, private sector will not do better than the public sector. But with the mindset or thinking that it's a smaller unit or is where they can access services quicker or whatever it is. But whenever things are wrong in the private sector, they will run to the public. But other people will tell you that if you have the connection for the public sector, it's better for you to be taken to the public sector. Now, how many, apart from Senegal, the other bulk go to Turkey? You'll be fine. Go and find out. People are not only, I know there's a lot of people going cosmetic to Turkey, but I can tell you people are going to Turkey for, serious medical conditions. Or some of them just to have their medical reviews. The services that could be done with the public sector. The proliferation of private clinics in the Gambia tells you a lot. Where the affordability is not, but you can see the number of these things. Who pay for all that? How do they pay for that? When people cannot even have a square meal. Tells you the kind of governance we have in place. I don't even want to call it capitalist. That's an insult to capitalist systems. It's just a poor management of a nation, poor governance of a nation. Apart from Turkey, how many Gambians go to India? India. Now, to access the healthcare, free healthcare within Europe, especially UK now, is very difficult. We used to have a bulk of those who are going today to India, going into these things, or some who could support their families to come to the UK, and everything else now is completely difficult now for people to access UK or United States, medical these things. Now, even the privilege or the supposedly privilege are affected by the poor services. Even if you can afford it, you will suffer. That should be of a concern. I know of many Gambians who plan to retire, who wanted to retire to the Gambia, but due to their underlying medical conditions, they can't afford it. I can tell you, I know of Gambians who cannot even stay in the Gambia more than 2 weeks. They cannot take that risk. It's a big risk to fund this stay. If anything happened to them, that's a death sentence. Is that a nation where we can spend millions for the first family medical? Do we know how much we pay for the first lady medical? Who is regularly going for checkups, who is regularly going for treatment in Turkey and other places? Do you know one of the family members of the president, how much she paid for IVF, even though she already had other kids? Because of she's married to another person today, she want to have kids for that person, she had to pay so much for IVF to have kids with that person. That's the privilege that we give them. A privilege we gave them. When people are dying in maternity wards, people are dying of malaria, people are dying of accidents, injury, people are dying of mental health, committing suicide and everything else. Every level of delivery is fair. Gambia used to be proud of the First Republic of one of the best primary healthcare systems. Primary healthcare system, immunization, and all the other kind of districts. We are one of the initiators of the Bamako Accord and many other initiatives. It doesn't have to be expensive at times. Yes, it does cost at certain level, but if we prioritize it, we can afford it. Rather than don't to continue this system of the few, and those few are now in danger. Let's look at that. I'll give you an example of a friend of mine who can afford it, who has a very good job in the diaspora, who can afford it, whose parents, in fact, can afford it for themselves. It's just the pride of a son trying to do something for their parents. It's not that even the parents need it. But the old man's life was put at risk in the Gambia. Could not have, when the old man was ill, because the old man already is part of those, if a certain age started to develop many things, part of those who are regular, visitors of Senegal. Came back from Senegal, pursued everything well, and living a better life. Obviously, suddenly get ill, and they had to struggle to get the MRI scan. Some places they go, or the machine is spoiled, or this thing or that. After having the MRI scan, they had to take that and send it to a physician in Senegal. The physician look at it. Also, it's a minor thing to fix, but that doesn't mean that the old man was not suffering, because the old man have already starting to lose speech. The old man was already disoriented, was not aware of his environment, could not even identify the people around. That's how bad it was. But the physician in Senegal, this is a minor thing that can be corrected in the Gambia. The physician even thought, because of the physician knows that this should be, in any country, be ratified. It's just a blockage somewhere that needed to be ratified. Guess what? They keep on running around for 24 hours. They cannot find any physician to do that. What do they have to do? They have to pay for airfares. Luckily, Air Senegal was due to fly that night. They flew out that night. How much does it cost? The cost would not matter to them. But why am I stressing on this cost? Other Gambians cannot do that. The cost only to evacuate, which is 2 people to support the old man. The cost of the ticket for the 2 people and the old man, and the special services the old man have to receive to the plane. And in most cases, in fact, the plane was not appropriate. A risk was taken to fly. These things are done by special ambulances where you can have the support and everything else. They struggle. But the minute the plane landed at 5 a.m. in Senegal, the old man started to have the special care needed. And to the hospital, by 8 o'clock, she was operated on. The issue had been rectified. Within an hour, the old man, regained, his speech, this thing. The old man regained that. The old man regained consciousness. The old man started to recognize his environment. And this is an hour. The time they got to these things, within a few hours, it's been ratified. If the old man had stayed a little bit longer in the Gambia, what would it be today? The son was so much touched, stressed, not only because of his old man, he was thinking of the conditions in the Gambia. He's saying, how can someone retire in this country? Even how can someone live in this country? Now, this is when you look at this and think of even the people leading that country, do they really think about this? Even if they can afford to fly out, they are still at risk. Because some interventions need to happen immediately in order to save some of these problems. If not, it will be too late. But they don't care. Because of their selfishness, they don't see it that way. Even to be taken from your house to a clinic or a hospital, you need certain, in some conditions, you need the treatment to start at the house. The treatment to continue in the ambulance before you get to the clinic. If not, it might be too late. There are levels of resuscitation that couldn't be done by manual help. You might need a defibrillator. You might need other equipment. There are other things you might need, and support to breathe and other things that can happen in an ambulance. Now, God forbid, if anything happened to you, who can guarantee an ambulance or a paramedic? Because everything we know about ambulance is so driven into one point A and point B. We don't understand that even the ambulance should be manned by paramedics, qualified paramedics. Oh, we can just put ambulances. We purchase 10 ambulances, 100 ambulances. But what keeps the ambulances? Even to maintain the ambulances. What system is that? Let me conclude. You see, why do I say, earlier I said I'll digress on this. Why do I say about politicizing of our healthcare delivery system? You see, as much as we criticize the First Republic, I am not saying they never had it perfect, because perfect cannot be attained. But again, I always want people to think about one thing. The resources we had then, and because there are many dynamics that we had in the First Republic, in the Second Republic we are now, but let me say in administrations. Because many people think the republics are Jawara, Jammeh, and Barrow. No. Republics are two. Because we haven't changed constitutions. We're still running on two constitutions. But let's say administrations. As much as we will criticize the first administration, there are so many things they had right. To the extent, I'm telling about facts. To the extent I know of my uncles, some uncles that used to travel from Guinea-Conakry to the Gambia for hernia operations or other form of operation, or operations for that matter, because they said that the English, they used to say, oh, the Angolais are good in operation. The French are not good in operation. They term the Gambian Angolais. I'm telling you, as far as Guinea-Conakry, I know of. And if that's happening from Guinea-Conakry, I can tell you what's happening from Guinea-Bissau and probably from Mali. I don't have relatives from there, probably I will not know. I just say probably. Dr. Jones and others. And I can tell you, recent incident that happened 3 years ago. I don't want to get into identifying people, but recent incident happened 3 years ago. A situation that someone needed an operation, to be certain kind of operation to be done. 3 years ago, it could not be done. The person was misdiagnosed for long. The time they finally find out this thing and needed operation. The clinician at the Edward Francis Small Hospital advised the person, say, look, if your people can afford it, rather go and do it in Senegal. And I can tell you, for the same kind of operation, Dr. Jones did that operation 30 years ago in the Gambia. From that 30 years ago or 40 years ago. About 40 years ago. Because the person, I know the person that, the person who went through the operation said that I did this sort of operation for about 40 years ago, my last child. I did this sort of operation. Now it cannot be done in the Gambia. That's how backward we went. That's why I said in the First Republic, The reason I'm not even talking about Senegalese, it was a known fact. It was a known fact. Not only many border villages in Senegal attend. I'm not talking about attending hospital. They were attending health posts in Phoenix and other places, health posts within Gambian territory, health posts. Because health posts were really manned. They have do the diagnosis right. They give you the medications you need. Health posts. Not talking about healthcare, this thing. Health posts. There's a difference between, some people might not even know that. But health posts, I can tell you. Where Monday, Wednesdays, and Fridays, the medical workers will come in and open for that day. And diagnose and medicate and do referrals. So many Senegalese used to cross the border to come and have that with us. But again, for treatment, many Senegalese used to come, our relatives come in, stay with us to have treatment in the Gambia. Today is the other way around. And again, what I'm pointing here, I'm coming to the barrow. Where did that fail? You see, as I said, healthcare is not about only the buildings. Healthcare is far more than that. It's about managing the totality of how delivery is done, the strategy, the priorities, and so on and so forth. When Yaya Jammeh came, with his politicization of the healthcare system, running here and there, I'm not saying that clinics or these things shouldn't happen, but there's always a priority, there's always a strategy, there's always something else to do. After a few years, I was in Senegal, holidays. I have a friend's family member who was admitted at one of the hospitals. I went to the hospital, almost an entire ward was filled with Gambians. I'm saying that I'm not blaming Barrow for what happened, but I'm blaming him for failure of 8 years of reversing. It could have been reversed in 3, 4, if he was dedicated in doing that. But he got it worse, because he followed the same with all the corruption. Jammeh demoralized the entire healthcare delivery system, kicking out people off, getting involved in clinical treatment and all those nonsense mumbo-jumbo treatment he came about with. Discredited people, undermined its healthcare system, promoted incompetent people to run institutions and say that he built something without even equipping it right. You cannot just buy a CT scan and think that you have a CT scan. There's so much that goes with a CT scan. The qualifications, the maintenance and everything, it goes far more. You need a comprehensive approach in delivering these things. We know the failure started there. If it was democratized, if it was done right, strategy followed, it would have enhanced what he have inherited, but he have undermined it and distorted. Not only undermined and distorted, and now governments are fixated. Oh, we have 10 ambulances. Oh, we have a new hospital. Did you get better? Did you have access to those hospitals? Now, how much does it even cost to access those hospitals? Now, coming with this fake insurance scheme. What a balloon. How can you say you have an insurance scheme when you don't have the means to treat someone? It's a scam. Increase, the access, even not now, it's not about the quality treatment, now even the access for treatment. You cannot even deliver that. Let's come to it. Now, everything they're doing, running around areas, they want to win over and put a clinic there, regardless whether it's strategic or not, whether that's the priority or not. When the existing facilities are not maintained, existing facilities are not equipped. Now, what are you going to achieve if you build new facilities when the existing ones are not being kept? In development, there's something called the built capital. The built capital means the existing capital you have in infrastructure. You cannot have Denton Bridge or Oyster Creek Bridge It's not been maintained. And now its lifespan is gone. Now you are going to build another bridge somewhere there. When you could have maintained a circuit bridge to be more efficient, to be more this thing, make more money from there and move on to somewhere else. No. Now, you cannot disregard Edward Francis Small Hospital. Even water supply cannot be constant. Electric cannot be constant. Clinical supplies cannot be decent. Gloves, sanitary. The infection cannot be controlled. And there's nothing systematic that you can say, we can achieve this. Ambulances, and you have it as a referral hospital. They don't have funds on an ambulance to bring in people. And ambulances, as I said, that are equipped well, that are manned by qualified medics that can make sure they give the care and treatment needed in the course of traveling to the hospital. You cannot achieve that. You didn't achieve that. You cannot even have functional mortuaries. You cannot have nothing absolute right. The basics of hygiene, the staff are not motivated. Everything is wrong. The corruption is rife. If you don't maintain that right, what tells us that the new hospital will be done right? That's why I said hospital is not only the infrastructure of the building, where you cannot maintain the equipment, the CT scans, the MRI scans, and everything cannot be maintained. How are you going to maintain the new ones that you're going to put in the other hospital? And you think then people have to abandon this hospital and make it disused and to run to be congested in the other hospital, even if that hospital is maintained right. Or in the beginning, if people think that it will maintain right. Now, all the people now running to the other hospital, what sense does it make? And overpopulated or congested or whatever it is, how can you have the service delivery right? Or the clinics in Bakau, lacking the basics for women to have children, and some of the complications would end up for needed referral to the disease. That's why I said, if you study development and understand development, if you look at the healthcare system in Cuba, they will tell you the approach of the primary healthcare system, where almost every area would have a doctor dedicated for that area that will look into the basics of that will keep you away from getting sick first. That would, you can have access to the doctor to be, or healthcare, they call them even not doctors. They call them social something. There's a terminology you use. But it's just like a healthcare post within our communities. And people get healthier. With the poverty in that country, people live longer. Poverty in that country. Go and look at the index, world index on healthcare delivery, world index in human resources, world index in longevity of life. That's what development is. And these people are under embargo. Imagine if they were not embargoed. Gambia, with all the resources we have, and we think with this corruption, we can achieve everything. Now, with the new hospital, with the corruption we seen in Edward Francis Hospital, not been dealt with, Serakunda Hospital, not been dealt with. Didn't we say Serakunda Hospital was state-of-the-art hospital? But we have abandoned that aspiration now because of the failures of administration. Now, with all this corruption going on in Bundung or in Brikama, where healthcare workers have been politicized to the extent of even people giving blood have to be selective, where we cannot even maintain a blood bank. A country that you see people running to Facebook, or someone need blood, we need blood A, blood B, blood C. How safe is that blood? If it is that urgent, what do we do to ascertain that blood was even safe? How can we ascertain that blood is safe? Because how urgent we need it. Why don't we have the blood bank that will manage the blood delivery systems and everything? We fail even for that. Now, he's doing the same thing as Jammeh did. I'm building clinics, I'm building this, I'm building hospitals, I'm building university. Now we have 5 universities. What does that mean? When one university cannot be run. Because to say that you have universities. When those things should be faculties within a university, now you turn those faculties into universities. When where the primary education have failed, secondary education have failed, where are you going to get the things? Not that the youths are stupid or anything, but because of the systems have failed to help them to hit their potential. How can, if the failure of the rate of failure in the primary and secondary, how can we have our scientists, engineers and others to go to those universities? There should be an entry requirement. How can we have the entry requirement where the bases are not been dealt with? This is what we are seeing here. We have seen the government so desperate, thinking that because of they understand the mindset of us, when we glorify roads, glorify this, and miss it of what we should look for, what the impact is, what's the value for the money. Now, you run roads in rural areas where people don't have water to drink, where people don't have water for agriculture, where people have implements for agriculture, when people have seeds for agriculture, and this is their livelihood. What are they going to do on that road? Those people will never own cars to run on the roads. They can't even maintain. You know, people think, oh, to have a horse is, I tell you, to maintain a horse is difficult because in the dry season, you have to feed that horse. And the horse do get ill. You see, that's why I said there is a way you make all these things. Roads are important, but they are not the absolute benchmark for development. They come part, they're integral, but they come part of a program. They come part of the strategy delivered. Now, let's come to this hospital. The over 100 beds hospital, now in Kafuta. The government, desperate to fool us again, just as Yajame used to fool us with these roads and everything. When people are suffering more, and people can access even these things, and now they come with this hospital, and they are misleading us. Oh, government is building this hospital. Yes, government is building this hospital, but did we ask how are we building this hospital? Government is spending $2 million. The World Bank is spending $22 million, part of the project to build that hospital. And if the World Bank spent $22 million, it's not even, when I looked at it, I cannot even see whether it's a grant or it's a loan. But I can tell that's nothing like a grant. At times, even it's worse to take a grant. When World Bank put money, there's something they want to have. And want to have is to keep us dependent. Keep us dependent onto their system in order to enrich the rich nation. Some of these things we can use our own resources and be independent of it and make sure it's sustainable. Just as you see recently in Senegal, still now the government is holding back, making assessing, reassessing, checking the figures, checking the numbers. With the IMF, they detected the corruption, and you think it's only Macky Sall that was corrupt with the case? No, IMF was part of it. IMF was part of it. Just as the World Bank and others are all part of the corruption that goes on in our countries. They brought out an initiative for self-finance in order to create jobs. Asking for 150 billion or whatever it is. They've got over 400 billion and the deadline is still got a week more to go. And for publishing the numbers now, even there's more confidence in the project that I can tell you within a week probably they'll surpass the they've already gone off target. They even get over 500 million or billion, you call them. And that can finance projects that will create employment, that will create wealth for Senegalese, because of the investment is by Senegalese. Senegalese are going to be paid the interest to the loans rather than World Bank, IMF or the Eurobonds or any other entity. And those Senegalese being paid interest, those Senegalese will get better off, they will pay tax, they will invest more. And the culture of investment collocated within Senegalese for self-funding. Do you understand part of how the middle class in the UK have been broadened? When the UK government started to sell the assets of privatization, the British Telecoms, British Airways, British Utilities, British this, British this, there's a bulk of the shares that was reserved for British citizens. And many people bought shares. On those shares today, turn many of those people into middle-class families. This is what they didn't take everything and just give to venture capitalists. So there's certain reserved for people to access. In the Gambia today, we gave 80% to Turkish for doing nothing, to taking over our port that is completely, with all the revenue coming through there. Why? Even if we are going to entertain a foreign investor, why can we entertain that 40% goes to Gambian shareholders? The other 40 to go to foreign and other 20 to go to government, and we have this year, and technically Gambia would still hold the greater interest. Because they only think about the kickback they have from it. And the same thing go for the Senegambia Bridge and anything else. But they want to scam you in going into a political road building that would is not economic viable. When the central bank governor and came, we'll talk about that later, another day, came to sell shares on putting a bypass in the mangroves, nonsense. It's not economic viable, and if you trust this Bois Sedi, you will be fooled. Anybody trust Bois Sedi, you'll be fooled. He's one of the biggest criminals right now in the country. Let's come back to it. Now, go and look at the so-called 5-star hospital they're gonna build. The 5-star hospital they say they're gonna build. You know the first challenge, what's gonna happen? You see, when projects fail from the design, the concept, the vision, then design. Let's just go to the design of the project. Let's all agree that it's good to have a 5-star hotel, hospital and so on. But let's think about the possibilities of maintaining. Because at the concept of developing something, you have to think about the maintenance, the sustainability of the project. Right now, as we said, talked about earlier, that if you cannot maintain the existing built infrastructure, how are you going to maintain the new built infrastructure? And if the new built infrastructure come in and take all the traffic from the old built infrastructure, how are you going to maintain that? Let's move from the other level, the infrastructure itself. Gallas, the councillor in Banjul, have made a point. I think he said the university have no disabled access. In this modern day of architected design, modern day of consultancy, how can a design architect fail to give access to disabled people in public building? How can a consultant fail to notice the failure of access to permanent disabled people in public buildings? It's the same company that built, Indian company that built how to call it, the House of Parliament, build that part of the university campus. Again, you give everything to an Indian company. They bring their foremen, everything else. There's no transfer, these things, or no, these things that will stay within us. But let's move to the bill. Now we have another huge, nice structure. Do we think about how do we maintain this? How much do we cost to maintain this structure a year? Cleaning, just cleaning properly. Clean the windows, clean this cleaning we think is cheap. No, it's cheap if you have a bungalow. But a structure like that takes a lot of money to maintain. You need special skill. cleaners to able to clean and maintain the structure. I'm just talking about the structure. The maintenance cost of the structure. We often see, even if a lift breaks at the airport, they have to run to Dakar to look for an engineer. How does it cost to bring that engineer to fix it? Or a lift will be broke in the airport and will take a month or more before it gets fixed. You see, that's why I said when you prioritize, train enough Gambians to become engineers, this, and when you build something, think about the sustainability of that. Now, think about the cleaning, think about the maintenance cost for a structure like that. And if you factor that into the budget that should run that hospital, how much would be left for medication, equipment maintenance, and others? Yeah, the hospital might come with brand new CT scan, brand new MRI, brand new this, brand new this. But to clean the facility, to maintain the facility, are two things. Now, the cost of, and now if you put people in those brand new things, have we looked at the welfare of our healthcare workers? Next minute we go and blame the nurses. Next minute we blame the doctors. Next minute we blame others. When many nurses now, that's why if you see them coming to, going to the Middle East, coming to Africa, Europe and America, yes, you don't blame them. Because of, they are not motivated back home. And they try everything and it's become difficult. And they are human. When nurses would get $8,000 and their transport and other costs, and there's no hope for them to ever own a property. There's never hope for them to even to able to afford to rent a decent place. And these people would be in the job for 8, 9, 10, 15 years. Who would aspire to be in a job that you start to have families? Your families will be going to the failed public institutions, schools. You see? That's why I said, going and build 5-star hospital, again, it's not only the thing, when there's no incentive. Housing, they motivate the staff. Junior doctors, how long does it take to become a doctor? Then, you see a bank clerk, I'm not putting down a bank clerk, but I mean the time you spend to educate yourself, the cost of education, time, dedication, and the importance of your job. A bank clerk in a money exchange agent is earning almost the same as you. What is the motivation for that doctor to be good? They might want to be good. They will try everything, but they're human. They will be frustrated. And you have senior doctors or surgeons, they go moonlighting. They go to private hospital, they spend more time, energy there. And they're human. They come to the public, they have no energy to give. Their thinking is blocked and everything else. How do you expect good services? That's why I said it takes so much more just to go and build a hospital. And again, the implications, if the money, 22 million World Bank put there, it's not a gift. Even if they say it's a grant, doesn't mean it's a gift. It's going to come somewhere in the policy framework. They will dictate how your medication is done, how something else is done. You will lose that operational independence that could have made you more sustainable. And the other implications, I said, giving a contract entirely to a foreign company and so on and so on. There's so much. Guys, that's much as we want to share now. As I said, the reason coming out is actually to get it out of me. But we all know that this is an existing problem and it's going to continue. The only way we can change this is to elect good leaders. There's no institution, there's nothing in the Gambia. That's why there's nothing in the Gambia that works. Because of the fish rots from the head. And corruption, to deal with corruption is the mother of all evils. With corruption, we have all these problems going on. With corruption, we have the incompetency. If people say, oh, incompetence is worse, but I can tell you it's because of corruption we have incompetency. People don't want to even hire people who are capable. The people don't want to hire people who are, who have integrity. You know, at times it's not that they don't have the certificate. No, at times they have the certificate, don't have the experience. At times it's not that they don't have the experience and the certificate, but they have a bad experience. Staying in one place or working in an industry for long does not mean that you have this. The most important part is what value experience do you have. Value, experience, emphasize. And people of integrity, those are the people that would harvest value, experience in any situation that arises. If not, that's bad we have. And if a leader that leads is bad, that leader is leading is incompetent, that leader is leading is corrupt, that's what he will replicate or she will replicate in that institution. Then the political leadership, wherever, don't take this calm. Many intellectuals or change is based on the people. Change is based on leadership. Change is leadership based. If people take up leadership, bad people take on leadership, they can bring about bad changes. Good people take on leadership, they can bring about good changes. And the example right now is in America. It's the same people in America. American people did not change. What changed is the leadership. It's the same people that voted Bill Clinton, give him 2 terms. It was the same people that voted Clinton, give him 2 terms. Bush and give him 2 terms. It's the same people that voted Obama and give him 2 terms. And the same people that voted Trump and kick him out and bring back Trump. It's the same people. Gambia, it's matter of who are this leadership. These are the privilege that they have the influence. Let me say the privilege that have the influence. The influence does not only mean education. The influence does not only mean money. The influence means dedication to whatever they do. And in Africa, the problem is the people that have little bit of money, they either invested in poor governance in order to have more money. Because of they're lazy, they don't want to invest in good governance and to have what they're deserving. People who have education are lazy not to work hard to build good leadership. They would rather go and associate with poor leadership that would give them easy right to do whatever they want. That's why I say it takes dedication and goodwill to bring about this. Today, people you see, if anybody tells you, and take this thing from me, that Barrow is good, just ask him one thing. If Barrow was not the president, and you have an enterprise, would you make Barrow your CEO? If that person is truthful, tell you no. And then you know that he's a hypocrite to champion Barrow to be your president. And I can tell you, tell that person, if Barrow was not your president, would you give your sister to Barrow? They will tell you no. Try that. If they tell you yes, you know they're lying. Because look at what they're doing. Whether it corresponds with Barrow does. If it corresponds what Barrow does, then they are like Barrow. That's why they would give it to Barrow. We can bring about change. But we have to be, intentional in wanting that change to happen. Thank you very much, guys. Have a good day.